my recording, and we are going live. So
Excellent.
let me turn off my preview here. Let me turn on my preview here. Perfect. All right.
Awesome.
Let me just make sure this is running like it should. All right. So we're going live with our first ever episode of Evidence-Based Esports.
Yes.
AKA the nerdiest PT name we could possibly put to applying evidence to how we practice PT and esports. So I'm Kate, AKA Dr. McGee. I'm a physical therapist. This is Matt. Matt is also a physical therapist, AKA HP for Gamers on Twitter. If you're not already following him, you should be. Matt, you want to tell people a little bit about you, what you do, that kind of deal?
Yeah, so I'm a physical therapist. Right now I'm working with CLG as their head of physical performance and esports medicine. So anytime they have injuries, I help them, or I also manage kind of their training on a day-to-day basis to make sure they don't get to that point where they are injured. And yeah, I've been practicing for like 2 years.
Yeah,
but it's good.
My background is physical therapy as well. I do a whole bunch of work in ergonomics, especially that preventative aspect. And then more recently, I've been on site at tournaments to help kind of address the little tiny things that crop up, which is very different than addressing the long-term chronic things that require a heck of a lot more than just, the occasional hand massage on site.
That's right.
All right. So we are starting off this monthly show. Fox players are more likely to get carpal tunnel. Higher APM are more likely to put more stress on their hands. But we're here today to talk about the role of the shoulder complex in hand pain, as well as the role of hand and wrist restriction in activation of muscles further up the chain. It's kind of like that, the rhyme that they taught you in 3rd grade about, the hip bone connected to the knee bone. That's never more true than when you're injured.
Exactly.
We're going to start out talking about middle and lower trapezius strengthening for managing lateral epicondylitis, which is a whole bunch of fancy words to say sometimes you got to use your shoulder to address pain at your elbow.
Yep. So I'm done then with that. You got it. Got it. Yeah. So I guess I can take it from here.
Go for it.
Basically, for the very first study, I decided to choose a case report on middle and lower trapezius strengthening, again, like she said, for the management of this condition known as lateral epicondylalgia. And for those that don't know what that is, that's your tennis elbow, your mouse elbow, or basically a repetitive strain condition for use of muscles here. So the back of your forearm, the opposite of your palm, and these are also your grip muscles. But it can either be a repetitive strain or a traumatic mechanism if you lift something up too quickly and strain this muscle group. Basically, this study wanted to look into the effect of strengthening your middle and lower trap, which are back here. Basically, that triangle of muscles that you see on really buff guys on the back. And they wanted to see that as an option for treatment of this condition. And the reason they decided to look into this was because, one, the current studies out there are scarce in looking at just single interventions on the management of lateral epicondylalgia, as well as most of the approaches currently are only directed at managing impairments localized in the elbow region. So things like iontophoresis, strengthening and stretching of your wrist extensor muscle group, NSAIDs, eccentric strength, splinting and bracing, everything is just localized there at the elbow. And there's absolutely a consideration of source versus cause, the argument, in that we only focus on identifying and treating impairments here, but kind of fail to consider things up the chain at your shoulder that can contribute to development of your pain here. So with this in mind, the case report I looked at, again, investigated the effects of just an exercise program, only an exercise program, and changing the strength of the scapular musculature along with the position of the scapula to address pain and limitations of an individual with lateral epicondylalgia, so mouse elbow. So I chose this study because I felt that it was really relevant to esports because it looks into a condition that can become really chronic. And chronic pain is actually, in my experience, really, really common in esports. And I want to elaborate a little more on why. And just because while a lot of athletes suffer from acute pain conditions, and like Dr. McGee probably sees thenar muscle strains or thumb muscle strains for Smash players, they feel the pain, but it's often devalued because they're young and they heal really quickly. So because of this, they just adopt this mentality that it's probably okay. I
I'm
rest
made of
it, I
rubber. I'll
ignore
get
it.
better. It's
Exactly. It
fine.
goes away. Seems to come back every now and then, but it's probably fine. So they don't really realize how chronic their condition is, and it's only till it progresses to a point where they can't play that they become concerned. And I think that's kind of the typical pattern for everyone that has pain as a gamer, and that we ignore some pain until it develops to the point where it's actually affecting us. So that's why I felt like this was relevant. This condition can become one of those chronic conditions, and let's just dive right in. So this was a case report. So they took a 54-year-old right-handed woman, and while very few gamers are that population, we can learn a lot about what they discovered. So her primary activities were to care for her 2 children, perform some daily household activities, and just some history about her pain in the elbow was that she first noticed it when she would do some volunteer work, which included things like carrying tarps and mulch, and medical treatment wouldn't work. So after 5 months of trying medication, going back to the doctor and trying different medication, it didn't change her pain at all. So she sought out further treatment and was referred to physical therapy. So a little more about her pain and the behavior of her pain. She had, again, the lateral elbow pain that occurred with movements requiring wrist extension, this thing, and also her activities of daily living, such as lifting her child or even scrubbing the kitchen counter. And this pain also woke her up once a night. And the only thing that really helped with easing that pain was ice, and it was just really temporary, which is pretty common that a lot of people try. So with this study, they used some outcome measures. They used a questionnaire called the DASH, which is the disabilities of arm, shoulder, and hand. And basically, it's a 0 to 100 scale. The higher the number, the worse your function. So she scored a 44.2 initially on day 1. And day 1, she also scored a 7 out of 10 on the numeric pain rating scale. So from there, they looked into the exam, and they cleared her shoulder and her neck, because that can sometimes cause some radiating pain that can mimic lateral elbow pain. They were able to provide a diagnostic, they were able to perform some diagnostic clinical tests to really rule in lateral epicondylalgia with things like Cosen's, Mills, and Maudslay's, and also just touching that area was able to reduce that pain. And this is the more important part. So they identified it during the posture exam. So they had her turn around, they had her with her sports bra, they looked at her shoulder blade, and they identified that the right shoulder blade was abducted, which means a little further away from the center of the spine, 2 centimeters compared to the right or left. So 11 centimeters on the right, 9 centimeters on the left. And what was even more interesting was that, hey, if they corrected that pain or corrected that deformity, the pain with her grip went away completely. So that was one of the reasons why they were like, wow, well, maybe we should look into middle and lower trapezius as an intervention. So during grip strength testing, without correction, she had 26.1 kilograms and a pain of 7 out of 10. With the correction, manually moving the scapula toward the spinous process or center of the spine, she had 0 pain with 33.7 kilograms, so more grip strength. And they also did middle and lower trapezius testing with Kendall positions. And to look into this sort of relationship a little further, they also did an EMG test on this specific muscle, one muscle called extensor carpi radialis brevis, which starts over here and goes down right over here into your wrist and does exactly this. So basically, what was cool is that if they corrected her shoulder blade and moved it closer, they reduced the amplitude of the EMG of that muscle by 44%. And I really want to discuss this near the end once I explain a little more. But basically, with all of this, they're just saying, hey, if you correct the scapula, that will one, reduce your pain with gripping, but also reduce the signal or reduce the usage of this muscle based on EMG. So they ended up using exercise progression from Shirley Sarman, and they saw this patient for a total of 5 visits over 10 weeks. And it was just a 4 exercise progression. And I'm going to show you guys what it looks like as I share my screen here.
Let me switch screens so that people can see your giant screen. There we go.
Yeah. So basically, if you see here, it's going from top to bottom. This is how the patient progressed in terms of the exercise. So it was pretty low load here. She's on her stomach. She's raising her elbows up, and she has to activate her middle and lower trap in an isolated way. So she couldn't recruit her upper trap or her posterior delt to compensate for weakness. So this was the next exercise, and then the next one, and then the next one. She does not look 54, by the way. That's insane. That was really crazy that I noticed that.
Oh, hold on a second.
Anyways,
The webcam's frozen apparently, so let me just double check what's going on here. Okay. Oh, I'm okay with your webcam being frozen if it means that the screen share is working. I'm just not sure that the screen share is working.
Well, but basically, these are the 4 exercises that they use, and she did them over the 5 visits, and afterwards, the score of that questionnaire, the dash, dropped from 44.2 to 0. So it went away after 5 visits of her doing this exercise protocol over the 10 weeks for 5 visits. And her pain level went to 0. Her scapular position was normalized, so back to that 9 centimeters on each side.
Matt, I'm just going to have you disconnect and reconnect because we are having a bit of problems with your mic. Okay. I swear I'm not hanging up on you just for a second.
Yeah,
we'll be right back with that.
No I'm back.
You are indeed back. You appear to not be frozen anymore.
Back. Okay, so.
But nope, you just froze again. Well, crap.
wait. Hold on. Let me. Am I back?
Let's see.
Is that?
Managed to shift into the right spot, and nope, then your camera immediately froze again. You got a really great expression on stream right now, though. Like,
oh, good.
I do have to say, your face made a really hilarious expression.
Good.
It's not frozen in that one. It's way better than that, actually.
Okay, am I back or am I good? I restarted my thing, my webcam, just to test it.
It immediately froze again. Hold on, let me try this. Let me take away the window capture.
Okay.
Let's try re-adding you back in.
All right.
Let's try adding you as media source this time.
We were doing so well.
We were, except for the part that apparently nobody could see your lovely face. Or they could, but they could only see it frozen in one very specific position. Well, that may be why I decided to stop detecting Skype entirely. Let's get rid of that. Well, in all fairness, this is, in fact, our first episode. There were bound to be at least a couple of hiccups.
We planned for this, actually. We planned for this.
We totally planned. This
is part of the plan.
Definitely part of the plan.
So you guys can just hang out, talk.
All right, let me do this. I've got a workaround. I just have to drag some things over here. This is one of those times when it is really convenient to have 2 monitors because when it gets to the point that the window capture is not working, I'll just tell it to capture an entire display. Ah, not that one. The other one. All right, there we go. No more infinite recursion. All right. So, theoretically, you should no longer be frozen.
Yes.
All right. There we go. Stream just saw the recursion.
Oh, it's big me.
It is big you.
Excellent.
Right. You appear to still be moving. You appear to not be frozen anymore. Think you must fix it. So, you were talking about how there was this exercise progression, and you were also talking about how this woman does not look at all 54.
Yes, and basically reviewing the outcomes. With the score of the questionnaire, it went from 44.2 to 0. The pain level went from 7 out of 10 to 0 by the 5th visit. The scapular position, so where the shoulder blades were, was normalized. And 5 out of 5, which is the scale that we use for strength testing, was achieved for the middle and lower trapezius. And then what was, I guess, more interesting was the grip was increased from, I think it was 33?
I think it was
33.7? Yeah, 33.7 to 42.2. So there was a 38% increase with only focusing on the scapular strength. So with all of this, the authors concluded that underlying causes for this condition, lateral epicondylalgia, should not just be restricted only to the elbow. Treatment of your shoulder blade position can be an effective option for those that are looking into the bigger picture to manage this pain. And one of the reasons why they felt or they thought this intervention was effective was potentially a pain inhibition mechanism, in that there's a reflex arc that connects the forearm and hand afferents and also connects to scapular muscles. And they suggest that if you activate the trapezius muscles, it inhibits some of the pain with gripping. They also stated that, hey, maybe if they normalize the mechanics and motor control with this corrective scapular position, that helped to resolve the pain. But they didn't really describe further into the detail as to why it resolved the pain. And because I always believe in first principles, I try to look into this a little further. And I think I have an anatomical reason as to why there was a reduction of the pain. So in sort of our traditional understanding of biomechanics, in the sense that if we load a weight here, we have a weight here, we do this, it loads or provides tensile stress at your proximal attachment here. But we don't consider things that like a fascial complex, which connects several muscles along a line here. And there's a fascial complex known as the superficial back arm line, which starts at the trapezius, right here, then goes to your deltoid, then goes down to your wrist extensor group.
And
so
just for those who don't have quite as much of an anatomical background, think of fascia like the sausage skin to the sausage that is your muscle. It surrounds it, kind of keeps it connected. It's like a chain of sausage
or
base.
when you eat fried chicken and you peel it off, there's that webby layer.
It's fascia.
That's fascia. That's fascia.
Delicious fascia based on our analogies here.
So good. And basically, this sort of connection almost helps us understand our bodies in a more dynamic way, in that despite these single joint anatomical attachments here, we can distribute tensile stress further up the chain. So if we activate our middle and lower trapezius, we don't have to have as much strain or load onto this actual muscle group because it's being utilized here. And this is concurrent with sort of the results that they found with the EMG activity, as well as just reduction of pain, because maybe with that area being irritated, they unloaded it a little bit, less tension there. During the gripping, there was no pain. So I think the bottom line with this is that we have to consider these fascial lines too, in the treatment of conditions along any kinetic chain. So even your butt down to your feet, but more specifically to this elbow condition, we have to just consider proper positioning of your shoulder blade, and how we can use that as one prevention, but also injury management for any conditions down the entire arm. And I want to help anyone that doesn't know what I mean kind of understand that by hopefully sharing my screen again and describing a little bit about it.
Let me switch to the giant cam.
All right. So I have a little drawing here, and I'm going to try to draw and show you guys what I mean.
All right, guys. We should switch this over to like a Twitch creative stream instead of a gaming talk show.
Yes.
All right. Draw away. So screen sharing is working.
All right. So basically, these are your shoulder blades, and there are 6 different ways your shoulder blade can move. One is elevation, goes up. 2 is depression, so it's sad. It's a sad scapula.
Let's go straight down.
3, there's abduction. It moves away from your spine, which is right here. let's say your spine is right here. It goes away, so that's abduction. And then there's 4, a direction, and it's called adduction, adduction. So I'll fill those in afterwards. And then there's a little more complicated one. It rotates up like this. It's called upward rotation. So this tip moves this way. And then there's the last one, which is downward rotation, where this area goes down. So it's the opposite of that direction. So those are the 6 different conformations of your shoulder blade. And for the most part, we have, let's change this. So the more common ones are having our shoulders be too depressed, so they're set downwards, they're too low, and they're also set away from your spine here because we have that rounded posture that we're all used to seeing. Gamers sort of assume when they're sitting at the computer or even sitting in front of a CRT monitor. And then we also see a little bit of downward rotation. This is not as big of a movement fault. I would say the most crucial ones are the ones that I'm starring, your depression and your abduction. And this means that a lot of the times there are practitioners that recommend you just do an upper trap stretch. So there's a muscle right here that goes like that. Your big upper trap, here's your shoulder, here's your arm, and you stretch this muscle. But if you think about it, if it's already down and if it's already out, then the muscle is already too long. So you don't want to stretch it. You actually just want to correct the position of the shoulder and move it. I know there's a lot of drawings and lines here, but you just want to move it. You just want to move it this upwards and inwards. Those are the only 2 directions you should consider sort of doing generally if you do have some either neck pain or even, like we found out, elbow pain, wrist pain, hand pain. That will help, one, set your shoulder blades, but also, like we just found out, reduce some tension in your neck and all the way down into your hands and fingers.
All right, so
hopefully this drawing, yeah.
Kind of
Sorry.
no. This, I happen to have a picture that might help
Yes.
people reference what you're talking about a little bit more. So here we have PewPewU and SFAT playing some Smash.
Boys.
You're welcome. Made sure to get some CLG fix just for you.
Yes.
So
yes.
You can kind of see from Zach's posture here. You can see that bony point of his shoulder blade here underneath the blue line of his jacket. Sorry, I have this up on stream, and you probably can't actually see this. I just realized.
That's fine.
But he's a little more rounded. You can see those the shoulders being pulled forward, the shoulder blade sliding along with it, and then looking at Kevin. Kevin's got a little bit more of like a straight back posture, and his shoulders are pulled back a little bit more. Yes, team beer. So in this instance, Kevin's doing a little bit more of what Matt is describing as far as moving the shoulder blades closer to the spine and a little bit more up. And Zach is doing more of what he's describing with the rotation and the down and out.
Yep.
All right.
A little more down rotation for sure.
Mm-hmm. All right. So we are back on the regular screen now.
Right.
So how do we go about incorporating the knowledge we've gained from this? You know, the knowledge that with proper scapular mechanics and kinematics, we can end up with less pain, improved activation. What kind of cues do we give players to remind them to get into this right posture, and what kind of exercise / follow-up do we do to really kind of maintain that good habit?
Yeah. Well, number one is because there needs to be someone that's actually there to kind of identify what the exact movement fault is. That's where we can be a little more individualized. But in general, because like I was saying earlier, we know that everyone's kind of in this rounded posture. It's out. It's angled downward a little bit. We want to do the opposite of that. So you don't just try to squeeze your shoulder blades together, which is a really common cue that's given. You can bring it together and then slightly up too. And that's really something that's not common in, again, what people consider to be doing a scapular retraction exercise or or squeeze exercise, and you'll notice the big difference if you incorporate that versus just going straight down and back. A lot of the times that's what's recommended, and we're sort of going in the opposite direction, but it's really based on our understanding of, hey, we know how people are sitting. It's already down, so we don't need to move it down any further. We're going to move it back and slightly up. We don't need to go too far up.
Nope.
But basically, I would use that as a cue.
Yeah, I think one of the best analogies I'd heard was imagine that you're a waiter serving a tray. So you're turning your tray out. I'm trying to see it. Let me see. I'm just really short. All right, so you're turning your tray out, but you're not dropping the tray down. You're keeping the tray up and passing it to people.
Yeah.
We do have a question in chat. Terrible back pain after long gaming sessions. Mostly sit at a desk. Partly has to do with bad posture, most likely. So again, as Matt suggested, it is utterly impossible to diagnose anything over the internet, and any recommendations we make are kind of the generalized ones. But as far as if you find that you're slipping into bad posture and you know you need to correct it, setting yourself a timer to remember to check in with your posture, feel what feels tight, what feels loose, what feels strained. Ideally, that timer is going off every half an hour, and you're getting up and walking around a bit, shaking things out, stretching what needs stretching, exercising what needs a little bit of a wake-up call. I recognize that I can say every half hour all I want, and that's not necessarily what's going to happen. But if you can at least check in with your body every half an hour to see what's going on with it, that's how you don't end up in that position where you're only stopping because you hurt too much. Setting that timer every half hour, actually taking that break, actually checking in with your body, and then addressing what you've checked in on, that's how you prevent it building up to the point that you have to stop.
Yeah, absolutely. I want to add on that a little bit in that, yeah, I think that's a really great option. And one thing just to consider is, what game is it that you play? You can have a plan beforehand. Like she said, you need to set a timer. And while sometimes it may be realistic to utilize a timer, most of the time we can just use queue times or competitive match times. So you can set it before you even begin playing. After 2 to 3 competitive queues or competitive matches, I'm going to get up and do a couple of stretches. And I'm sure there's a mountain of resources out there, but I think considering what we talked about today, you should do that scapular setting exercises back and up, slightly up, and maybe even investing in something like a little foam roller, and just getting up, just to give your shoulders, all your musculature a little break. Because right now, if you are already getting pain with long gaming sessions, it might be an endurance thing, but 2, you might just be doing too much and not resting. So I think definitely consider what we both said. Give yourself a break. Having a plan before you start gaming.
Right.
That's the biggest part of it. And not enough people consider that or take that into consideration.
Right. You got to use what time is available to you, which sometimes it's a conveniently timed, to the minute break, and sometimes it's more like, okay, every time I die, because I'm going to be dead for at least 30 seconds, I'm going to do 10 of this exercise. Or while I'm in queue, I'm going to be standing up and moving. That's breakdown dance moves. Every time I'm in queue, I'm going to be standing up. Or those little opportunities you have, rather than, feeling like you have to take this huge, big half-hour long break and do all these exercises, add them in little by little. Make them daily and hourly habits rather than making them out to be this big, massive exercise you have to add into your schedule. It's a lot more easy to make it a habit when it doesn't feel like an imposition to do so.
Exactly. And I guess this is sort of a shameless plug, but I have kind of like a 5-minute miracle sort of exercise routine I made, and I just posted it in chat. Oh, let me see if I can post it.
Here, if you link it to me, I can set it as a command.
Oh, sure. I'll link it to you right now.
All right.
There we go. Yeah, right there. Basically, if it's kind of wrist pain that you have, welcome to episode 2. This is a 5-minute exercise routine that has been helpful for some individuals that I've worked with.
Right. And again, as Matt and I said, it's not as though we're suggesting that every single person has the exact same needs and deficits, but generally speaking, there's a whole bunch of things that are fairly common to most people. And these things they're not going to harm you to do these exercises, and in all likelihood, it's probably going to help. And Matt's having another dance party. All right. So we did also look into another article, kind of going the opposite direction. First article looked at the effect of further up the chain and how it impacts further down the chain. The second article we looked at started looking at the presence and absence of a restriction of the wrist joint and seeing how that changed activation of various muscle groups further up the chain. They did this by using an EMG to measure electromagnetic activity in the muscle, and then looked at how much do these muscles get isolated. That is, to what extent are they the primary mover doing most of the work, if the wrist is or is not restricted, and then they performed various exercises and activities to test those. So they were looking at a whole heap of muscles up and down the arm. As we discussed earlier, the trapezius and middle deltoid were on there. Biceps, triceps, extensor carpi radialis, which was the one that Matt talked about earlier that does this motion. And then the flexor carpi radialis, which is the opposite side, does this motion. I'm not sure how well the camera actually caught that because, again, I am short. Hopefully it went through okay. So generally speaking, they wanted to look at if you have an issue at the wrist, does your body have certain mechanisms that it relies on to compensate? Do they make significant changes with regards to mobility, with your ability to perform activities of daily living? Are you employing different muscle groups? Are you still trying to force employment of these restricted areas? So what they did was they took 20 individuals, 15 women and 5 men, all right-handed. Nobody had any underlying injury history. So in this case, this is a group that is fairly similar to a good deal of the gamers we work with, in that they are college students who have no real significant history other than they just do normal everyday student things.
Good.
All right. So what they found was that there was, in fact, a statistically significant heart, statistically significant difference between the percent isolation, that is the extent to which one particular muscle was taking on the load, when there was and was not a wrist joint restriction. They looked at carrying a cube. They looked at doing a pegboard task, which is picking things up and putting them in very precise areas, and that's fairly relatable for gamers. They found that when the wrist joint was not restricted, the percent isolation of the forearm muscles was higher than when the wrist joint was restricted, which makes sense, right? If a joint is restricted, you need to find other ways of making the movement happen. So rather than activating the thing that moves just the wrist, you're going to activate things further up the chain. It is important to note that there was a reasonably large amount of variance across the subjects, but that's not to say that these results were not still indicative of when there is restriction, we compensate by significantly using abnormal muscle groups or non-standard muscle groups would be a better way of putting it. Most significantly, when the wrist was restricted, for grasping, pinching, and pegboard tasks, the little precise movements, the percent isolation of the upper trapezius was significantly increased. And when carrying something, which might be analogous to holding a controller for a prolonged period of time, the percent isolation of the upper trapezius and the middle deltoid back here, upper trapezius, middle deltoid, significantly increased as well. So what that tells us is when you restrict the wrist, you engage the shoulder more. It increases shoulder movement and muscle fatigue, and that makes sense because we're compensating somewhere that doesn't normally have to compensate. What they did find, though, was given that increase in shoulder movement, that's a decrease in shoulder stability, which means a less stable base for your elbow and your wrist and your hand to be working from. This ties in really well with what we were talking about in the first article, namely that when you don't have that good base, when the scapula isn't moving or positioned in a way that is optimal, you're going to have disruptions down the chain, like pain at the lateral epicondyles. With regards to grasping and pinching, it's not just your fingers that are involved in this. You need to stabilize the wrist further up the chain to be mobile at the fingers further down the chain. So there's that play on stability and mobility being very much related. The biggest limitations of this study were that these were all healthy subjects, which is a limitation for most physical therapy, in that normally we're treating people who are already injured. But when you're invested in a population that may not be chronically injured yet, and you're trying to prevent chronic injury, this population is pretty darn applicable and pretty useful for us. This was also all subjects in their 20s, which is, technically speaking,
right
probably
there.
the upper end of some of our subjects, but for the most part, really fits our groups well. So the thing that really interested me about the possible applications of this study, and the fact that wrist restriction resulted in more engagement further up the chain, and then more stability here resulted in increased mobility further down the chain. We see certain in certain games, we see really high DPI on the mouse, which causes you to rely very significantly on rapid and very precise and very forceful movements of the wrist, of muscles that aren't necessarily designed for quick and forceful at the same time. And I was considering the possibility of, if we want to help retrain some patterns in those players, if we want them to start engaging further up the chain more, because what research suggests to us is that use of a lower DPI mouse results in increased use of the elbow and shoulder complex to move the mouse for the larger and broader movements, and kind of reserves the hand and wrist for the smaller, precise movements. So if we were looking at someone who is having significant hand or wrist issues with a very high DPI mouse, very quick, very large, very forceful movements of the wrist, if we wanted to help train them to engage their shoulder more, it might be worthwhile to consider restricting movement at the wrist. Obviously, this is not a permanent solution, because as the study showed, it decreases the stability of the shoulder. This increases the muscle activation and the muscle fatigue at the shoulder. So it's not as though this is saying that we should restrict wrist to make shoulder move more as a permanent solution. But what it does suggest is, as a short-term exercise or intervention, we could use this to cue more use of the shoulder and elbow, and then gradually progress back to not restricting the wrist while maintaining those better movement patterns.
Yeah, I think that's great. It's a really great suggestion, especially if there's an acute sort of condition. We can utilize that as a temporary intervention. But definitely the motor coordination sort of,
it's a big change.
The trade-off is, do we want to really elicit the motor coordination change when that has been what has been working so well for them? Or it's just nice to know that that's a really great option.
Right.
I think to reduce that.
The option is the key word there. To a very large extent, top-tier players are kind of a self-selecting pool, in that you don't become a top player and stay a top player if you have these absolutely horrible habits that cause you to continuously get injured and not fully recover. So clearly most of the top players are already doing a good deal of things right. But when you come across a situation of somebody who does have a significant hand issue that requires them to take time off, it's possible that as part of kind of a return to play protocol, you might involve a kind of exercise like this to cue a slight change in the movement pattern, while not suggesting that they solely move with their elbow and their shoulder, but that they start incorporating that so they can save up their wrist and hand muscles for those more precise movements and the less forceful ones.
Yeah,
option is the key word there.
Right. I think that's great, especially for the return to play.
Yeah.
It can be utilized pretty well for all your FPS games.
Yeah,
so
for sure.
That's exactly it.
Yeah, that's definitely
really cool.
Yeah, it's a pretty cool option to consider.
It's really interesting because it totally coincides with the study that I looked at, and also this sort of same fascial line, that same superficial back arm line, like the upper trap down to the posterior delt, down to your extensor group. It's the same thing, which is really, really interesting in that, hey, now we know it's not just 54-year-old women. Okay, it's 20s,
We've confirmed
20-year-old kids
it's a
too, right?
generalizable population.
Yes.
Excellent.
Yes, it's generalizability.
Yeah, which
Thank
is
you for that.
yeah,
That's what we
that
needed.
so like just as a small aside, it almost never happens in PT research that you get a generalizable study that goes to so many groups. So when it actually happens to a group that we research or a group that we work with, we get really, really excited about that fact.
Yes.
Because not only is
Yes.
this evidence suggesting, this thing in this particular population, it fits the group we work with. There are things that we can directly do that will be useful. We like being useful.
Yes. Yes, we
So
do.
I was going to ask actually, because since I was at Summit this weekend and saw a couple of these players in the process, I was going to ask if the scapular mechanics or the scapular kinematics, was it all something you discussed ever with Kevin and Zach?
I think I briefly touched on that. It wasn't something that I had focused on. I focused a lot more on sort of the having a plan before you start
Okay.
playing and recognizing, understanding sort of the physical stress theory and realizing, hey, your muscles only have a certain amount of endurance, and at a certain point, it'll start to strain the musculature. So it's a good idea to stretch when you're taking a break. Really more behavioral and lifestyle management versus really specific scapular strengthening. But seems like Kevin has done well. Zach might need a refresher with me.
That's all right.
I miss them. But anyways, yeah, I think I probably will touch on that the next time that they're back at the house.
I have to say the other person I saw at Stretch Summit was Armada was doing a really good job with that as well.
Nice.
He does a really good job of keeping like a nice a flat spine rather than a rounded spine when he's leaning forward. And you can definitely see it in his shoulder blades and in his shoulder complex. It's
Nice.
really, really blatantly obvious. Even more so when it's just in particular players. Yeah, and you
That
got
is
fans
perfect. Woo.
Uh-huh.
Nice, Armada.
Yep. Also, you've got fans in chat right now, in case you're
Good.
not on stream.
Laz,
Yep.
my boy.
All right. So, to kind of, is that why Armada is so good? Well, independent of his really nice posture, Armada is an excellent player. But it kind of goes back to what we were talking about with regards to top players being a self-selecting pool, and that you don't get to the top and stay anywhere near the top if you are constantly injuring yourself.
Right.
So yes, having good posture and having good body mechanics are absolutely going to allow you that increased practice time, that increased playing time, that increased muscular endurance, increased recovery ability.
Yeah.
All of those things, really play into your ability to be good and to stay good at what you do. All right,
Totally.
so kind of to wrap up, to sum up what we all talked about over the course of the night. We started out talking about how further up the chain affects further down the chain, about how the importance of good scapular mechanics really plays a role. And it's not just about pulling things down or pinching the pencil on your spine and pulling them back. It's sometimes a little bit about pulling up as well as pulling in to get that good positional set. And to keep in mind that there are many mechanics in place as to why many mechanisms in place as to why good mechanics here would decrease pain and fatigue down here. It's partly about reflex arcs. It's partly about the fascia. It's partly about decreasing strain. It's partly about having a good base of stability so you can have improved mobility down the chain. And our second article really tied into that as well, talking about how restriction at one causes more movement at the other, and how you can play off of those two things as an option to try and train some new movement patterns potentially.
Yep, totally. So I think the bottom line is just consider the position of your shoulder blade throughout your gaming sessions, and in the way that we described, going back and slightly up. And that can limit a lot of overall development of pain conditions. So reducing risk of injury for the neck, reducing risk of injury down in the elbow, wrist, hand. But remember, that's just one part of it.
Yep.
The behavior, the plan, having a plan for when you play, make sure you take enough breaks, like we had mentioned earlier, is going to be another big part too.
Yep.
So
All right, three big. I guess the three biggest takeaways then would be, thing one, consider your shoulder blades. I feel like I'm quoting the Bible. Consider the lilies of the vale. Consider the shoulder blades on your back, and the position of them. Thing two, have a plan before you start playing or practicing, to take the appropriate breaks and to address things as they crop up, rather than after they become so bad that you have no choice but to stop. And thing three, actually use your gosh darn equipment that's available to you. Use your backrest when it's there. Use a foam roller if you got one. Use an exercise program if you have one. And all of those things together will all contribute to improved gaming longevity, I guess.
Yep.
All right.
Those are perfect.
All right. So this has been our first episode of Evidence-Based Esports, aka two esports PTs geeking it out about esports and PT. This is going to be a monthly occurrence. Stay tuned for an announcement about what next month's topic will be, because we have no idea what it is yet, but it's going to be interesting, I'm sure.
Yes.
Make sure that if you liked what we had to say, feel free to follow the channel. Feel free to follow us on Twitter. I'm Caitlyn McGee, PT. This is HP for Gamers. We answer questions to whatever ability we can.
Yeah.
All right. Have a good night.
Yeah. Thanks so much.
Of course.